Thank you for the kind introduction. It's nice to be here. Thank you for the organizing of this very interesting and nice symposium. I will switch now from pain to allergic rhinitis because for more than 20 years, that's one of the focus of my research. So I have a small disclosure. So I received some reimbursement and honoraria from TCM societies and received a small funding for a research team from a company selling acupuncture devices. I think you are very familiar with allergic rhinitis. It's a very common disease, and you can classify it in seasonal allergic rhinitis, it's like birch pollen, and persistent allergic rhinitis. We know that there is a high prevalence for allergic rhinitis. It's about 10 to 25% in the industrialized countries. So we speak in Germany about 50 million people. The complementary medicine is much used for this disease. About the lifetime prevalence is about up to 50%. And the use of acupuncture is also quite high, about 20%. So I thought about how much is allergic rhinitis, acupuncture and allergic rhinitis investigated, and I made a small research about that. And you see here the publications in the Medline search, and I have about 30,000 hits of acupuncture and pain, about 8,000, and then follows cancer, depression, and stroke. And the allergy is not so much investigated, so we have 800 hits, and the other atopic diseases, which are always also interested, like asthma and atopic diseases, there's even less research. So there are slightly more evidence for acupuncture, and there are also more research in the last 10 years, but the evidence in 2009 was very limited. So there were 2 reviews, including altogether 12 trials, 7 of a better quality, and the conclusion was very neutral, I would say. There's currently insufficient evidence to support or to refuse the use of acupuncture in patients with allergic rhinitis and or more large, well-conducted RCTs, which overcomes the situation were urgently needed. So I start very early to do research in this field, and I used the reversed strategy for complementary medicine treatments. So I start with a clinical experience where many acupuncturists say, why you only focus on pain? The allergic rhinitis is a very, very good indication for acupuncture. So we start with a pilot study, with small pilot study, and then we did a comparative effectiveness study within the model project of acupuncture, and then finally we did a sham-controlled 3-arm clinical trial, and I will show you in quick the studies. That's the first pilot study, and we did it with a acupuncture society, the SMS in Munich, and we're starting from a very pragmatical side, and we say normally the practitioners use acupuncture and herbal medicine together, and we say, okay, if it's like this, we want to study this. So patients with seasonal allergic rhinitis were included in the study, and we divided and randomized them into acupuncture and Chinese herbal medicine, like the TCM group with 26 patients, and sham acupuncture and non-specific Chinese herbal medicine. You cannot say it's a placebo, it's non-specific, it's a control group. And they get 10 treatments over 6 weeks, and you can see here the results on the rhinitis quality of life questionnaire and the global symptoms, and both outcome parameters decreased significantly compared to the non-specific or sham acupuncture group. So that was the first trial, and we published it in Allergic 2004, and then we go a step ahead. We made this very large acupuncture in routine care study, which Claudia already mentioned before. It was a pragmatic, partly randomized study. So we asked the patients, there are more than 5,000 patients, is it okay that you will be randomized in a waiting list group and in an intervention group? And 75% of the patients said, no, we want to have the acupuncture from the beginning on. So we have an acupuncture group without randomization, and the other 25% we randomized in two groups, acupuncture after randomization and the waiting list control after randomization, and they received no acupuncture. And you see what happens here in the rhinitis quality of life questionnaire. Both acupuncture groups decrease significantly after 3 months compared to the waiting list group. And as a waiting list group received also acupuncture, it decreased also to the same situation. So we have here an effectiveness study where acupuncture works also in the routine care setting. And then we go ahead, when we try to get an application by the DFG, and it takes long time, 3 years about, and then we can convince them. And then we did the ACUSAR study. It was a trial in more than 400 patients, seasonal allergic rhinitis patients, and they were randomized in 2-to-1 manner to the acupuncture group, sham acupuncture group, and the rescue medication group. And the acupuncture group received 12 sessions of acupuncture, and the sham acupuncture also 12 sessions in the first 8 weeks. And then we have a group where they get only rescue medication. And that was cetirizine. Acupuncture and sham acupuncture can also have the rescue medication if it's urgently needed. And there, the main outcome measure was after 8 weeks. And then we have a follow-up after 16 weeks. And then we wanted to know, is acupuncture still effective after this period? Because many physicians and acupuncturists say, in the next year it's better. And we say, okay, we want to do this. The DFG say, you can do that. We see no sense in that. But and then we follow them also in the second year, allergic rhinitis, over 8 weeks. Here are the acupuncture points. They are, of course, all published. The main points were large intestine 4 and 11, large intestine 20, and extra point yin tang. But we have also in this semi-standardized procedure other points which can be chosen by the acupuncturist. And here are the sham acupuncture points. We use some points from our art studies, but there was not in the head. There was in the upper leg and the upper arm. And here are the results of the study. Here's the rhinitis quality of life questionnaire, the specific quality of life for allergic patients. And you can see after 7 to 8 weeks, the acupuncture groups has the best effect, better than the sham acupuncture in red, and the waiting list or the cetirizine group has the worst. And the effects of acupuncture was significantly better than the cetirizine group and better than the sham group. There were no effects in the rhinitis quality of life questionnaire between week 15 and 16, but after 7 and 8 weeks in the second year, we have also a good effect of acupuncture, although the patients get no acupuncture in addition. You see, here is a better effect of the acupuncture group compared to the sham acupuncture group. And then we decided to use also a second primary outcome parameter, because they say, okay, maybe the rhinitis quality of life is better, but the patients of the acupuncture use more cetirizine. And here you can see the results of the rescue medication score. You see it's similar to the rhinitis quality of life. Acupuncture yields the best effects, significant better than the sham acupuncture group and the rescue medication group. After 16 weeks, no effect. And again, the patients in the second year took less cetirizine compared to the sham acupuncture group. So we have a double positive effect for both primary outcome measures. And I will skip that now because Claudia said already something to the cost-effective analysis. I want only to say acupuncture was not cost-effective intervention, and you see here the cost-effective ratio, but you have to say this is only between baseline and month 4. So if you have a long-term follow-up, we have to recalculate again because you see that there is a long-term effect of acupuncture in the ACUSAR study. There are now 2 other important studies which I want to mention very quick. There was a very good study also published in Allergic 2013 from a Korean-China group. And they have 12 study interventions, and also they compare also active acupuncture, sham acupuncture, and a waiting list group in patients with persistent allergic rhinitis. And they have positive effects in the total nasal sum after the end of the end of 4 weeks, the intervention, and also after the 4 weeks follow-up. So positive results in the nasal symptom score, but in the non-nasal symptom scores, they have no positive effects. And there's another study which was published in 2015, also in a very famous journal by Sieu, acupuncture in seasonal allergic rhinitis. They included 174 patients in Australia. The study intervention was the same as in the study before, 12 interventions, and they compared acupuncture to sham acupuncture only. You see they have some similar points like in our study, like large intestine 20 and large intestine 4. And they have good effects, positive effects in the medicational score and also in the sneezing score. But I have to say, there was not so positive like in the ACUSAR study. There are some scores which were not positive. So there is a reanalysis in 2015 of our trials, acupuncture in allergic rhinitis. And now we have more trials and include more patients. And there was a significant reduction compared to the control group in different outcome parameters like nasal sum score. It seems to be that acupuncture works in the best in the nasal sum score and also in the medication score. That means that the patients have to use less medications like antihistamines, and also in the serum IgE and the improvements of rhinitis quality of life. And now the evidence, 2015, is much better than 6 years before. And they say our meta-analysis should suggest that acupuncture could be a safe and valid treatment option for allergic patients. And now it is getting also in one of the guidelines. You see the clinical guidelines in allergic rhinitis of the Clinic Otolaryngology Praxis Guideline. And they made a statement to acupuncture and say the evidence grade is B. It's positive based on randomized controlled trials, however with limitations, observational studies with consistent effects, and they say clinicians may offer acupuncture or refer to a clinician who can offer acupuncture for patients with allergic rhinitis who are interested in non-pharmacology therapy. So that's the first guideline which includes acupuncture. We are now running 2 other trials. One is finished yesterday. It's a CAMA-TOP study in which we want to investigate if acupuncture and osteopathy, not together, there are 3-armed trial, are efficacious in patients with atopic dermatitis compared to a waiting list control group. So we will have the results, I think, in mid of next year. And we just started this year an acupressure study. It's a pilot study like this study in 40 to 60 patients where the patients should, for themselves, use the acupuncture points, press them twice a day, and we have some reflection of some patients who say, oh, that works quite good. So it can be that acupressure used routinely is very effective. So another question is a mechanism of action. How can acupuncture work in seasonal allergic rhinitis? And we have to say the exact mechanism of action of acupuncture is not known. There is a good publication published in Evidence-Based Complementary Medicine, and they used some hypotheses about that, and they stated that a complex neuroendocrino-immunologic network works together. I'm very convinced that also the sympathicus and parasympathicus play a major role, because we make a small trial in the ACUSAR trial, a small population of 30 patients compared to 30 healthy patients, and it showed that seasonal allergic rhinitis patients have a higher heart frequency rate. It's a stronger sympathicus. They have a reduced heart variability compared to healthy patients. So and we know that acupuncture, but also sham acupuncture, decreases the sympathicotonus, and also the patients get more in a relaxing state. But there are also some other issues in the mechanism of actions, especially the pro-inflammatory cytokines, interleukin 6 and 10 is downgraded. So I think this is not a single mechanism of action. There are many actions works together. So to sum up, the use of complementary medicine, including acupuncture in seasonal allergic rhinitis and also in persistent allergic rhinitis, is high. There is a growing evidence that acupuncture works in allergic rhinitis, and I have to say also it is safe, because the studies all show that acupuncture is a safe treatment also. But the mechanisms of action of acupuncture in allergic rhinitis have to be investigated in the future. I know Vitaly have started some of the research in this, and I think it may contribute also to the discussion of the overall mechanism of acupuncture, because maybe acupuncture have some additional effects in allergic rhinitis, but other effects like in pain diseases. So I want to say thank you to the whole research group, and I want to say thank you for your attention.